So when he was first diagnosed, the first thing I thought to myself was, okay, what's really important here is that I'm a family member. I'm not his doctor because, I saw patients at the Mayo Clinic. There were a lot of family members who were doctors, and they'd take care of their parents like they were their patients. I'm like, I'm not going to fall into that trap. I'm going to be the daughter. And then the first guy he saw was a bit of a Charlie, I really didn't like him at all. He put Dad on a completely inappropriate couple of meds, and I just had to say something.
Right, I remember that in particular. It just didn't add up. But you also did some other things for Dad, clinical suggestions. Like one of them that I'm thinking of is when you put the blue tape on the floor, the painter's tape, and you would put it at these regular intervals in the floor in their house because it would help guide his footsteps so that he wouldn't stumble because it gave him something to focus on. So it was a gait improvement or something. But the other thing that comes to mind is when he was getting his first walker and you gave him some expert advice. What he needed to look for in a walker.
I don't remember.
You told him to get a red one because it improved visibility.
That was good advice.
Yeah, and then later you told me, I told him to get a red one because a red walker is more fun than a black walker. But you were always bringing these sort of practical arguments to his attention because, our dad is a scientist.
I mean, even though I did stuff for him, the biggest treatment that he had that other people didn't have is our mother.
Oh, yeah.
If I could prescribe our mother for every Parkinson's patient, they would do much better.
I mean, this is the love of her life, you know?
The love of her life who, when he was really confused and in the ICU, said to her, let's steal a car and get out of here.
Exactly.
Which was a very good idea considering the circumstances.
Yeah, it was a bad place to be.
Do you ever worry about getting Parkinson's?
Well, I do, but not much. But I think you worry about it more than I do.
I used to worry about it.
Mm-hmm.
I don't worry as much. After Dad died, even though I'm an expert in Parkinson's, I went to a special, event for Parkinson's patients, and I just got really tearful, and I could barely handle it.
Yeah.
Just because I saw so much of his own suffering. I mean, when you're somebody's doctor, you see them 30 minutes, you take care of them, you help them, you do what you can, you see the next person. But when it's your dad, it's all the time.
Mm-hmm.
And you really get to know what they're going through. And it was rough.
Well, he was sick for almost 20 years.
Yeah.
He wasn't really sick in the beginning, and he could still travel, and he certainly enjoyed himself. But, do you think maybe in a weird way that his being sick actually helped us, or maybe you in particular, be closer with him because of that link?
I think so.
I do, too.
I think so, because I feel very close to our dad. And I love him a lot,
Closer than when we were growing up?
Yeah.
Yeah.
I'd say so. I mean, it's weird to think that pain can lead to intimacy, but it kind of has to because you kind of have to be there for each other. And you and I were there for him the last week of his life, the last 2 weeks of his life. I mean, we were there for him, and I'm proud of that.
One of the last interactions I had with Dad was he was in his hospital bed and couldn't even talk. He had that sore throat and his voice was already diminished. And he and I had always liked doing crossword puzzles together. So I said, "Oh, well, what's this, Dad? It's a 5-letter word for celery-like. Starts with C." And he says, "Crisp." And I said, "What?" And he says, "Crisp." This is a guy doing a crossword puzzle on his deathbed. And I thought, he's a pretty cool person.
Oh, yeah.
How about you? Do you feel like you got to say goodbye?
The last words I ever said to him were, "I love you, Daddy." And it just came out. And the fact that I called him Daddy was like very little girly. And I realized, I had this, professional relationship. I had all this disease knowledge. But at the end of the day, he's just my daddy, and I was just his little girl.